Hello, my name is Olivia Gatto, and this is going to be my case study presentation. So just some information about the patient or the client. So the patient is 55 years old. He's a male and he presents in the office with rotator cuff tear. He's complaining of severe left shoulder pain, limited range of motion, weakness with any overhead movement, or difficulty lifting over 20 pounds. The patient is planning to undergo surgical intervention to repair connective tissue damage this upcoming week. He does not report any chest pain with physical activity or without physical activity. Currently has a resting blood pressure of 192/72. He's very active daily and he's employed full-time as a chef. So it's really important to him to keep his body active as much as possible before, during, and after the recovery process, just to maintain his lifestyle and his quality of life. So the diagnosis presenting in the office, on the left-hand side, you'll see a picture of an MRI of a supraspinatus muscle or tendon, the way that it should look. So if you can see the light blue part all the way on the left-hand side, that's the origin of the muscle or the tendon. And the color gets darker coming all the way across the length of the muscle or tendon and where it should insert. You can see it comes all the way across, all the way around the ball of the humerus to attach on the lateral side of the shoulder. So this is what a normal MRI should look like. You see that this spot right here is where it should insert. And then you come on the right-hand side. This is a picture of the MRI from our patient. You can see that it comes across the top part of the humerus, but it doesn't reach the length of where it's supposed to. So this missing 13.47 millimeters that you see written down right here in yellow, that's the tear. So that's where the tendon or the muscle was disconnected. So some of the treatments and medication, he's currently on meloxicam, which is an anti-inflammatory, which treats inflammation, swelling, or pain in the joint that he presented in the office with. The surgical repair of the rotator cuff tendon was done on Wednesday, February 1st. And then 2 weeks post-surgery, we're going to begin PT and an exercise program, which is Monday, February 20th. So there's a couple pictures down the bottom of this slide as well. If you start all the way on the left-hand side, this little lip here, or the little hole, is almost an exact representation of the tear that our patient has. So that hole should be completely solid all the way through. There should be no space. So you come down to the second picture down the bottom here. This is just going to be a start to finish of the surgical repair of the tendon. So generally what happens in the surgery. The second picture here is 2 screws going through. Third picture is threads that go through the screws and through the top of the tendon, and then the pulling close of that hole, and then the stitching through with another set of screws. This sutures down the healthy tendon back into the damaged tendon to completely repair the tear. And then we moved on to the PAR-Q results, 3-page PAR-Q, just answering all the questions to make sure that he was cleared for exercise before we began. So there were a couple of questions that we said yes to. Some of them being the currently having, within the last 12 months, bone, joint, or soft tissue, ligament, or tendon issue, which was the rotator cuff, so we said yes to that. He does also have slight hypertension as well, stage 1 hypertension, so we just wanted to be aware of that as well. But going all the way through the clearance PAR-Q questionnaire, we were able to clear him for exercise, so he was healthy to begin. And then we move on to the exercise testing. Due to the patient's low risk of ischemic heart disease determined by age and symptoms and recommendations that we follow from ACSM's guideline for exercise testing, a clinical exercise or stress test wasn't really indicated, so we didn't feel the need to go through with that. But the patient was hypertensive with 192/72 resting heart rate, but not within criteria that would indicate a clinical exercise test to be necessary. And then a health fitness evaluation. Sorry about that. The health fitness evaluation, we found with a resting heart rate of 92 beats per minute, resting blood pressure of 192/72, we found that to be relatively healthy range to continue, other than the slightly elevated blood pressure. So our program is going to include strength and flexibility of the affected connective tissue, so that's what we wanted to begin evaluating currently, and the status of that before we begin. So with the strength, we wanted to do strength of abduction, which would test the supraspinatus, internal and external rotation of the shoulder, which would test the infraspinatus, teres minor, and subscapularis, which those are just other muscles or tendons that are going to be in the rotator cuff that combine and do a force coupling action to make sure that the rotator cuff is functioning properly. And then a flexibility test, we just wanted to do passive movement across the body. So we had a therapist passively moving the shoulder through all different types of range of motion just to see where his limitations were. And then client reports minimal pain and discomfort with some tightness as well, which is to be expected at this point in his recovery. So then we move into the exercise prescription. So the special considerations, we wanted to make sure that there was no overhead heavy weight, no weight over 2 pounds. We wanted to keep movement at the waist level. We wanted to make sure we included passive and active assisted work. Massage can actually help relieve some of the tightness that they feel in the scapula and take some tension off of the rotator cuff as well. We also wanted to always include a general and a specific warm-up just to prevent any further injury. So getting into the prescription, with cardiovascular endurance, we always want to include this in an exercise program just for overall health and fitness. So we wanted to make sure that we're doing that at least 3 times a week, some light to moderate intensity for about 40 minutes. Type you can do walking, jogging, biking, swimming, anything like that. And then the strength and the flexibility is something that we were really focused on as far as recovery and range of motion. So the frequency for the strength is we want to do at least 2 days a week. And to begin after recovery, we want to have light intensity, meaning lightweight. So nothing over 2 pounds during recovery, because that can aggravate the incision point. It can aggravate the muscles around the tear, especially directly post-surgery. We want to make sure that we're progressing in a way that doesn't push the patient too far, where he either feels discouraged by his progress or he further injures himself. So the type, we can do cable or band movements, and we can do free weights as well, as long as, again, they're under 2 pounds. And then we jump into the flexibility or range of motion. This is going to be really important with this type of injury because the flexibility and range of motion is more important for everyday life than strength is. So we want to see that the patient can come all the way above their body, all the way behind their body, and all the way across their body, especially since he's a chef. Those kind of movements are going to be really important in the kitchen, grabbing pans or mixing, things at a table. So we just want to make sure that flexibility is something that we were really focused on. We don't want to stretch to a point of pain or discomfort, so we wanted to passively or actively move to a point of slight stretch or discomfort, just to get enough in there. And then the time, about 30 to 60 seconds per stretch. And then for type, we want to definitely include active and passive static stretching. We want to do active and passive PNF. And we want to do dynamic before strength workout as well. So the next 2 slides here are going to be some examples of strength and flexibility activities that we can do during PT, or they can do it at home as well. So this first page is going to be the strength. The first black and white image that you see, the top left-hand corner, is going to be your internal and external rotation. So that's something that you can do. If you don't want to use a weight, that's okay. But if you are going to use a weight, just again making sure it's nothing over 2 pounds. So that's going to be your internal and external rotation. The picture right next to it with the green band is how you're going to incorporate the strength training, how you're going to incorporate the resistance. So that type of resistance band is going to provide a resistance, but not too far or not too heavy that it's going to be damaging. So that's performing your internal external rotation with a weighted band or with a resistance band. The second image, the second black and white image right below that is going to be your abduction. So that's lifting your arm up to the side of you. You can also, I didn't include any pictures, but you can also do a front raise as well. So you can do abduction from lateral, or you can do abduction from the front as well. And then the picture right next to it is going to be the same way, just abduction. You're just in a different position. You're going to be on all fours versus standing up. But it shows how you can use a dumbbell as well. Again, just making sure that it's nothing over 2 pounds. And then flexibility. All of these pictures here, 2 of them are going to be active, so the patient is going to be doing it themselves. They're going to be moving their own body. So you can see the ones coming across the body here with a static stretch and a hold, coming on top of the body here with a static stretch and a hold, and then coming in front of the body with a static stretch and a hold too. The other images that you see, excuse me, with a therapist, the PNF stretching is really popular in therapy for rotator cuff tears, because you are able to get an increased range of motion with the hold, relax, or contract and relax, or you can do a hold or contract, relax with the agonist action as well. So this can be really effective for individuals who have rotator cuff tears and they're feeling that the really inhibiting tightness in that joint capsule. The PNF can be really effective for that, especially with a therapist who's trained in PNF stretching. So then moving to our last slide, this is going to be the progress that I saw of our patients. This was 6 weeks post-surgery, which is a total of 4 weeks post-exercise program. The date on this is Wednesday, March 15th, 2023. The client reports some soreness and slight tightness in the shoulder, but is performing banded and free weight strength activities already, and active and passive stretching and therapy. He notices significant improvements in range of motion, which he claims is due to the stretching. He feels like the stretching is helping him a lot get his range of motion back. And then I've just listed some of the exercise that we completed over the past 2 weeks and that we were able to see the patient not be able to perform in the beginning of recovery to being able to perform after recovery, which was really cool. So one of those was internal external rotation with a resistance band. So what he did was he was not able to directly post-surgery to internally and externally rotate with any resistance at all. So he could do it with his arm, but he couldn't do it with any resistance. So what was really nice to see at the end of the 4 weeks of the program, he was able to use a resistance band to internally and externally rotate his arm. So I think that was interesting. He also was performing 2-pound dumbbell frontal and lateral raises, which in the beginning he would be able to lift his arms with his body weight, but he was never able to add weight to it. So I was able to see him use 2-pound dumbbells and lift to the front and then lift to the side. I also saw him do some across body static stretching. So every time he came in, he would come a little bit farther across his body and he would look at me and say, "Did you see that? Did you see how far I come?" Which I thought was really nice to see. And then the last one I saw him do was the trainer-assisted PNF. So I was able to actually go into the PT office with him and watch them do PNF stretching of the supraspinatus via the shoulder abduction. So what they had him do was lay sideways on a table, and the therapist would reach his arm all the way to the back, hold it, an isometric contraction, and then he would relax it, and then keep doing that, and then at the end where there was a passive stretch, he was able to go a little bit farther and increase his range of motion a little bit more. So that was really interesting. I really enjoyed doing this project because I feel like I was able to see somebody come in the office, a client, patient come into the office with a really major concern and go all the way through surgical intervention, physical therapy, and an exercise program to really increase his quality of life and his range of motion and his strength. So that was great. So thank you very much.